Hi, my name is Carlos Llanos. I'm going to talk about the assessing children's risks for dental caries and parental preventative practice. Definition: dental caries remains is the most prevalent chronic childhood disease in the USA, 5 times more common than asthma and 7 times more common than the high fever. This disease is known as early childhood caries, incorrectly defined as the presence of one or more decayed, missing, or filed surface in any primary tooth in a child aged 6 or younger.
Early childhood tooth decay is a reality and leads to pain and discomfort, lost days at school, poor nutrition and disrupted sleep, and impacts growth and development, especially speech. Early childhood tooth decay is a reality, but it doesn't have to be your child's reality. Oral health starts early. Good oral health comes from regular cleaning at home, at least twice a day. And regular visits to a dental professional. Starting in the first year. So remember, first visit by first birthday. For more information, call Public Health at 519-376-9420 or visit our website at www.publichealthgraybruce.on.ca.
Application in dentistry. In dentistry, we can prevent this type of injuries by carrying out treatments such as fluoride application. Fluoride prevent dental caries by inhibiting demineralization of the crystal structures inside the tooth and enhancing remineralization. Pit and fissure sealants. The majority of dental caries in young children occur in pits and fissures. These areas often too narrow for any oral hygienic measures to be effective. Oral hygiene, since dental caries do not progress without the bacteria present in dental plaques. Daily plaque removals by brushing, flossing, and rinsing is one of the best prevent dental caries. Xylitol is one of these sugar substitutes. Xylitol has a sweet flavor comparable to sugar, and it is not only not carcinogenic but also anti-carcinogenic.
Deep pits and fissures are the source of some 80% of tooth cavities. This is mainly because food and bacterial plaque lodge in these tight crevices and are often inaccessible to toothbrush bristles. Plaque acids and enzymes at the base of these grooves cause the tooth enamel to dissolve, eventually leading to cavities. Over the years, many attempts to stop pit and fissure tooth decay have been made. Here are the most common, their strengths and weaknesses. Fissurotomy, or prophylactic odontotomy, involves funneling the grooves open with a cone-shaped dental burr. If done early enough in grooves that do not extend through the dentin layer, it may be possible to perform this procedure and nothing further. More commonly, however, the deepest pits and fissures do extend close to or into the dentin layer, and this procedure must be followed by placement of a filling of some type. The procedure must also be performed by a dentist, since it involves removal of tooth structure. The grooves can also be cleaned out less invasively with a microabrasion handpiece, which sprays a stream of abrasive particles deep into the pits and fissures to remove plaque bacteria and roughen the enamel surface. Since microabrasion doesn't completely eliminate the deep, narrow crevices, it is usually followed by placement of a dental sealant. If the preparation of the groove extends into the dentin layer of the tooth, a filling is placed instead. Following thorough plaque removal from the pits and fissures, the tooth is isolated from all mouth moisture and the grooves are etched with a mild acid solution. This produces a microscopically roughened surface into which the sealants will adhere. The sealant is then applied to the grooves as a viscous liquid, which hardens on its own or by exposure to a blue light. Once placed, the sealant prevents bulk plaque from being able to accumulate in the pits and fissures. But sealants do have some potential downsides. It is possible for microleakage to occur along the sealant, especially if moisture is present when the sealant is placed. If leakage does occur, it may be difficult to detect until a large cavity develops beneath the sealant. It's important to remember that sealed teeth are not completely resistant to tooth decay. It's a big mistake to relax nutrition and oral hygiene standards on the belief that sealants alone will prevent cavities. And remember to see a dentist regularly to have the sealants evaluated for signs of failure, part of any thorough oral exam. Left alone, a poorly contoured failing sealant like the one shown is at least as prone to decay as an unsealed tooth.
Pros and cons. Pros. Be sure to schedule routine dental appointment with a pediatric dentist. Parents should brush children's teeth with fluoride toothpaste once they see that the first tooth is coming in. Thought about the types of toothpaste and fluoride washes appropriate for your child's age and need. You can start flossing your children's teeth. Do so as soon as the teeth begin to touch each other. And the cons, it is important to know that chronic caries can affect the quality of life of children and young people, and in turn can affect their growth. Untreated caries and the associated infection can cause pain, discomfort, and therefore reduce food intake because eating is painful. In addition, sleep disturbation can affect leukosteroid production and growth.
I'm Dr. David Nichols. I wanted to talk to you today about your child's dental health and how to prevent dental caries, better known as tooth decay. Tooth decay is the most common infectious disease of childhood. It occurs when sugars in the mouth are broken down by bacteria that create acids in the mouth. These acids will degrade the dental enamel. Fluoride and reduced exposure to sugar will help prevent this process. One way you can get fluoride is when you're mixing your baby's formula to use fluoridated or fluoride-enriched tap water. If you use well water or bottled water, your child may need to have a fluoride supplement. A way to reduce sugars is to never put your baby to bed with a bottle. Once your baby's born, you need to start cleaning their teeth once or twice a day with either a wet finger or a wet wash rag. Once the first tooth has erupted, around 5 to 7 months, you need to start brushing their teeth with a fluoride toothpaste. You need to brush their teeth approximately 2 minutes, 2 to 3 times a day. And remember, the last thing that should touch your child's teeth before bed is a toothbrush.
Issue applied in Ecuador. According to the author Amado, in a study on prevalence of dental caries in Ecuador, he found that children aged 3 to 11 years had a prevalence of 62%, and in children aged 12 to 19 years, a prevalence of 31%. In Ecuador, there is a program called Plan Nacional del Buen Vivir, where the Ministry of Public Health and the Ecuadorian Institute of Social Security intervene with the aim of improve the epidemiological profile of the population. The prevalence and incidence of the dental caries after the action carried out will demonstrate the importance of applying both preventive action and oral health promotion to create habits of hygiene of health from an early age. Therefore, the professional and the parent should always work together before the risk of a new appearance called caries and thus avoid many oral disease in the future.